Hello everyone. Today, we will be discussing a critical topic: stroke. 1. What is a stroke? Stroke is also known as cerebrovascular accident. This is a condition in which the brain is seriously damaged because the brain's blood supply is interrupted or significantly reduced, causing the brain to lack oxygen and not enough nutrients to feed the cells. Within minutes, if there is not enough blood supply, brain cells will begin to die. Therefore, people with stroke need immediate emergency treatment. The longer it lasts, the more brain cells die, which will greatly affect the body's ability to move and think, and even lead to death. Dead. There are two types of stroke: ischemic stroke and hemorrhagic stroke. Ischemic stroke accounts for about 85% of all stroke cases today. This is a stroke caused by blood clots blocking the arteries, preventing blood from circulating to the brain. Hemorrhagic stroke. Hemorrhagic stroke is a condition in which a blood vessel to the brain ruptures, causing blood to flow massively, causing brain hemorrhage. The reason why blood vessels burst is due to thin or weak artery walls or cracks and leaks. 2. What is the cause of stroke? There are many factors that increase the risk of stroke, including non-changeable factors and medical factors. 2.1. Elements cannot be changed. Age. Anyone is at risk of having a stroke. However, older people have a higher risk of stroke than young people. After age 55, every 10 years, the risk of having a stroke doubles. Gender. Men have a higher risk of stroke than women. Family history. People whose family members have had a stroke are at higher risk of having a stroke than the general population. Race. African Americans are nearly twice as likely to have a stroke as whites. 2.2. Pathological factors. History of stroke. People with a history of stroke are at high risk of having a subsequent stroke, especially within the first few months. This risk lasts about 5 years and gradually decreases over time. Diabetes. Problems related to diabetes can increase the risk of stroke. Cardiovascular disease. People with cardiovascular diseases are more likely to have a stroke than normal people. High blood pressure. High blood pressure causes increased pressure on the artery walls, over time causing damage to the artery walls, leading to brain hemorrhage. Blood fat. High cholesterol can accumulate on artery walls, forming obstructions that block blood vessels in the brain. Overweight and obesity. Overweight and obese people can lead to many diseases such as high blood pressure, blood fat, and cardiovascular disease. Increased risk of stroke. Smoking. Studies have shown that smokers are twice as likely to have a stroke. Unhealthy lifestyle. Eating irregularly, without adequate nutrients. Lack of exercise is one of the causes of stroke. In addition, stroke is also believed to be related to the use of stimulants, drinking too much alcohol. 3. Signs of stroke. Signs of stroke that can appear and disappear very quickly, over and over again, include: the body is tired, suddenly feels powerless, the face or half of the face is numb, the smile is distorted, difficult or impossible movement of limbs, paralysis on one side of the body. The most accurate sign of a stroke is the inability to lift both arms above the head at the same time. Difficulty in pronunciation and clear words, stuck words, unusual lisp. You can perform the test by saying simple sentences and asking the patient to repeat them. If they cannot repeat, the patient is showing signs of a stroke. Dizziness, vertigo, sudden loss of balance, inability to coordinate activities. Reduced vision, blurred vision, unable to see clearly. Severe headache. The headache comes on very quickly and can cause nausea or vomiting. You need to listen to your body, and when you see these signs appear, proactively see your doctor as soon as possible for a checkup. The golden time for a stroke is 60 minutes. With each minute that passes, the level of damage to the nervous system becomes more serious. 4. How to prevent stroke. 4.1. Reasonable diet. The cause of stroke comes from cardiovascular diseases, diabetes, blood fat. Nutrition is an important factor determining the formation of these diseases. Eating a reasonable diet is an effective way to prevent stroke. Eat lots of vegetables, fruits, beans, and grains. Eat lots of white meat, seafood, and eggs to supplement protein for the body, and limit red meat. Limit foods high in fat, fried foods, and fast foods. Limit sweets and foods high in sugar. Drink lots of filtered water, fruit juice, soy milk. 4. 2. Daily exercise. Exercise helps increase blood circulation in the body, improve health, and help keep the heart healthy. Exercising 30 minutes a day, at least 4 times a week, will reduce the risk of cardiovascular disease, leading to stroke. 4.3. Keep the body warm. Cold exposure can cause high blood pressure, increased pressure causing blood vessels to burst. It is necessary to keep the body warm and maintain health, especially for the elderly during the changing seasons. 4.4. No smoking. Smoking is one of the risks that increases the chance of having a stroke. Cigarettes also harm the health of yourself and those around you. If you quit smoking within 5 years, your risk of stroke will be equal to that of someone who has never smoked. 4.5. Regular health checkups. Regular health checkups, early detection of stroke-causing factors, and proactive intervention will help prevent strokes effectively. People with diabetes, cardiovascular diseases, and blood lipids need to have regular health check-ups to control the condition and not let the indicators exceed dangerous levels that can cause stroke. Regular health checks are one of the ways to early identify and prevent disease, especially for patients with a history of stroke, from which a treatment plan can be created to achieve optimal results. Once again, thank you so much for watching this video, and I'll see you in the next one. Take care, and have a fantastic day.